All right, guys, this is chapter 31, orthopedic injuries. Yes, I realize that it's spelled weird, but apparently we're going with the European version. So the human body overall is a well-designed system in which form, upright posture, and movement are provided by your musculoskeletal system. You also have protection of your vital organs. So when you have an injury, your bones, muscles are susceptible to those external forces, and you also have like your tendons, your cartilage, your ligaments that are also at risk. Musculoskeletal injuries are often pretty easy to identify because they have some pretty common signs, so pain, swelling, deformity. Although musculoskeletal injuries are rarely fatal, they can result in short or long-term disability. Skeletal muscle attaches to bones, usually crosses at least one joint. Skeletal muscle is called striated because it has those stripes within it. It's also called voluntary muscle because you can directly, voluntarily move it with control of the brain. Your skeletal muscles make up the majority of the mass of your body. All skeletal muscles are supplied with arteries, veins, and nerves. Blood through the arteries brings oxygen, glucose, and nutrients to the muscle. Waste products are then carried away by the veins. Skeletal muscle is directly attached to bone by tendons, which are very tough, kind of rope-like fibrous structures. And then you have the fascia that goes over top of all of your muscles, which then extends out into create that tendon. The skeleton gives our body the shape and the form that we have, protects our vital organs, allows us to move. The body is made up of approximately 206 bones. Your bone also produces blood cells and serves as a reservoir for important minerals as well as electrolytes throughout the body. Your skull ends up protecting your brain. And then you've got the thoracic cage, which protects your heart, lungs, great vessels, basically all of those vital organs up in the thoracic cavity. Your pectoral girdle, also known as your shoulder, consists of 2 scapula and 2 clavicles. You've got a picture here. The clavicle acts more like a strut than anything in order to help keep that upper arm and the portion of the shoulder propped up. Because it's super slender, it is pretty prone to injury. So clavicle injuries are very, very, very common. The majority of your shoulder is stabilized with muscle, so that can be very easily injured as well. Your upper extremity extends from the shoulder out to the fingertips. You've got 3 major bones. You've got the one in the upper arm called the humerus, the 2 in the lower arms called the radius and the ulna. You've got 3 sets of bones in your hands. You've got your carpal bones, which are that wrist bone there. You've got your hand bones in the center, which are your metacarpals, and then you've got finger bones, which are your phalanges. Your pelvis supports the majority of your body weight and also does protect the structures within the pelvis, which include the bladder, the rectum, and then female reproductive organs. The pelvic girdle is actually 3 different bones that are fused together. So you have the ischium, the ilium, and the pubis. The lower extremity comes from the hip, where there's a ball and socket joint all the way down to the ends of your toes. You've got 3 major bones in the leg as well. So you've got the femur up top, You've got the larger bone in the bottom of the leg, which is the tibia. This forms your shin bone. And then you've got the fibula. In your foot, it's very similar to your hand. You've got the tarsal bones, which are forming the ankle. You've got the actual bones that run the length of your foot, which are your metatarsals. And then you have your toe bones, which are called your phalanges, just like those in your hands. So the bones also provide a place for all of your muscles and your tendons to attach, which then allows for movement. Whenever two bones come into contact, you end up having a joint. Some are movable, some are not. It just kind of depends on where you're at. Your joints are held together by a fibrous structure called a capsule. It's supported and strengthened in areas by bands of tissue called ligaments. In moving joints, the ends of the bones are covered in a thin layer of cartilage known as articular cartilage. Joints that move are also bathed and lubricated in a fluid called synovial fluid to allow for motion. And joints that have a circular motion, such as the shoulder, you have hinge motion, such as the knee and elbow. You have those that have very, very minimum motion, your sacroiliac and your sternoclavicular joints. And then you have joints that don't move at all. So like the sutures within your skull have no motion. The mechanism of injury, often from musculoskeletal injuries to your bones and joints, are often associated with injury to like your surrounding soft tissue, and this is known as the quote-unquote zone of injury. You have a couple of different types of mechanism of injury that can cause injury, such as fractures and dislocations. You have direct blows, indirect forces, twisting forces, and high energy forces. Your direct blow, you end up having an injury such as a fracture because that bone itself was hit. Indirect force can cause a fracture, but can also cause dislocation at a point away from that point of contact. Twisting forces are pretty common, especially like in your ankle and your knee. So like your ACL tends to get hurt by twisting, your MCL in your knee, your ligaments in your ankle when you twist an ankle, and you can also get fractures with that as well. And then high energy injuries, you have damage to the skeleton, the surrounding soft tissues, vital organs. This can occur in like car crashes, falls from heights, gunshot wounds, and then just other really extreme forces. Keep in mind though, it does not take a massive, like significant MOI in order to cause a fracture. Just a minor fracture can cause, or minor force can cause fractures. An area that's weakened by like tumors, infection, osteoporosis, or other congenital defects. So fractures themselves is a break in the continuity of a bone, and it does not have to go all the way through. There's two different types. There's a closed and an open, and I think we've talked about these terms enough that you can very quickly identify one from the other. Your first priority is to determine whether the overlying skin is damaged. If not, the patient has a closed fracture. With an open fracture, you have not only the break, but you also have an external wound. You need to treat the breaks in the skin as a possible open fracture and try to prevent that increased blood loss that comes with the break in the skin and the higher likelihood of infection. You also are going to describe fractures as to whether they are non-displaced or displaced. A non-displaced fracture, also known as a hairline fracture, is just a simple crack in the bone. It's really hard to determine if this is different from a sprain or a simple contusion without X-ray. A displaced fracture is what's going to actually cause that deformity within the limb or distortion. It can shorten it, rotate it, angulate it, but those are pretty easy to tell the difference. We often have special terms to describe the different types of fractures. We have comminuted. This is where the bone is broken into more than two fragments. You have an epiphyseal fracture, and this actually goes through the growth plate of a child. This can lead to growth abnormalities. A green stick is an incomplete fracture that passes only partially through the shaft of a bone. This often occurs in children because their bones are a lot softer. So if you imagine trying to break a stick that's super young, it's not hardened like the rest of the tree, it kind of splinters at that point of force. An incomplete fracture is one that doesn't run completely through the bone. An oblique fracture is when the bone is broken at an angle, and it usually results because of a sharp angled blow to the bone, and it just kind of breaks. A pathologic fracture is where you have a weakened or diseased portion of the bone, and this is takes very little force to actually break it. This is typically seen in your patients with osteoporosis, tumors, or some sort of cancer that has weakened the bone. Also in osteogenita imperfecta, so weak bone syndrome. You've got spiral fractures that are caused by a twisting force. It causes an oblique fracture around the bone as well as through the bone. These are common in like snowboarders and skiers because they have the twisting motion of their board or their skis kind of rotates their leg around. That's where we see it often. The other place that we often see spiral fractures are in children that have been subject to abuse. Parents grab the arm and pull. It causes a twisting motion as well, and they end up breaking one or both of the bones there in their forearm. And then a transverse fracture is a fracture that occurs straight across the bone, usually the result of a direct blow, but you can also get a transverse fracture from like a stress fracture from prolonged running. You want to suspect a fracture if you have one or more of the following signs. So a deformity, the limb may appear to be shortened, rotated, or angulated. Always use the opposite uninjured limb to kind of compare the two so you can see. Tenderness, you may have point tenderness on palpation, and this is usually the most reliable indicator of an underlying fracture. Obviously, if you have a massive deformity, it's going to kind of give it away too. Guarding, the inability to use an extremity is the patient's way of trying to immobilize it to minimize your pain. If you think about those bone ends are going to rub together every time you move the fracture, and so they're going to naturally want to splint. Your muscles around the fracture are also going to contract to try and splint it. Swelling, you usually get rapid swelling because you have bleeding from a fracture, and then you get substantial pain. Bruising, most fractures are accompanied with ecchymosis, which is that bluish coloring around those soft tissues. However, bruising may take quite some time to develop, so don't use that as your only sign. Crepitus is that Rice Krispies feeling, that's that grinding sensation that can be either felt or sometimes heard when those bones rub together. False motion is motion in a limb that should not be there. Exposed fragments, obviously, if you have an open fracture, it's pretty easy to see that it's broken. We do not replace any broken pieces, leave them alone. Pain, and then a locked joint. If a joint is locked in a position and won't move, that could be indicative of fracture. Those bone pieces can kind of get down in there and make it to the point where the joint won't slide like they're supposed to. We'll go ahead and stop here and continue on in the next one.